Do you need a knee replacement?
Or how do you know? How do you know when you're ready?
All right, well, let's tackle this topic now. We're doing Talking with Docs podcast style because we're sitting down where we can have a discussion about this, because this one takes a little bit of discussion. It's not the kind of thing we can just shoot off in 2 minutes, okay?
Right. Agreed.
So I'm asking, do I need a knee replacement? That's the question that people come into the office wondering.
Right, so the short answer is I'd say, no, you don't need it. You might want it, or you might feel like you need it, but it's not cancer, or it's not an infection. So can you live without getting a knee replacement? Yes. Is your quality of life going to be poor because you don't get one? Potentially. So that's kind of how you have to get to that decision.
Okay, kind of semantics, right?
Yep.
You're saying, do I need it? I've never told anyone that they need a knee replacement.
Agreed.
It's a treatment option that's available to you to try and control your knee pain that's caused by severe arthritis.
Right.
All right, so now the question is, well, should I exercise that option to have my knee replaced?
Okay.
That's another way of saying it, other than saying, do I need a knee replacement? And what are some of the factors that go into a decision that you should consider before you replace your knee?
Okay, so for me as a surgeon, the one thing that you're going to have before I would consider replacing your knee is you need to have advanced arthritis, or the appropriate pathology.
All right.
So just because you have a sore knee, just because you want a knee replacement, that does not necessarily mean that a knee replacement is the best thing for you.
It's going to help you at all.
Right, so I want a good weight-bearing x-ray that shows that you have reduced joint space or advanced arthritis in your knee, and that I want that to correlate with the symptoms or the dysfunction that you're telling me about related to your knee.
All right, so Dr. Weening wants to see an x-ray that shows severe arthritis before he considers replacing your knee. I would like to see, in addition to that, that's one of the most important things that I have to see before I consider replacing your knee. And the reason is because if you have a normal looking x-ray and I replace your knee, you're not going to feel any better. So you have to have pain.
But what about, do I need an MRI though? Why does my doctor not order an MRI?
No, an MRI for me in the decision process of knee replacement is useless.
Agreed, that's right.
Because you're not standing on it. I know.
Yeah. You do, okay.
Because you play a doctor on YouTube, so you know what's going on.
I think why you think I didn't know the answer.
Yeah.
You don't need an MRI.
No.
But people ask that all the time. I need an MRI. How can you replace my knee without an MRI?
Now, having said that, some centers use robotic assisted surgery, and those require an MRI for calibration and for registering and to get the robot to understand what your knee looks like before they use a robot to help you replace your knee. But to make the decision as to whether or not you should replace your knee, you don't need an MRI.
Okay, deal.
Okay, period. You do not need an ultrasound of your knee either. Since we're on the topic of things you don't need, an ultrasound is not required to make the diagnosis with it. The ultrasound of the knee is 99.9% completely useless. Unless you have a mass there that we're worried is a tumor, and we're trying to look and see if there's blood flow to that mass. This is very rare, 1 in 10,000. Then an ultrasound might be helpful. But the majority of the time, you do not need an ultrasound of your knee.
Right. You'll probably get one. It's going to say you have a Baker cyst, which you have another video about, but it's all related to the arthritis and it's not necessary.
It plays zero role in your decision as to whether or not to replace your knee.
Okay.
Got that?
Got it.
Okay. So the next thing I need, in addition to radiographic imaging that proves you have arthritis in the knee, is pain.
Okay.
You have to have pain in your knee.
Right.
All right? It can't be pain in your hip that's referred to your knee.
Right.
It has to be pain in your knee. Because if you're not having pain in the knee, and then I replace your knee, it's unlikely that you'll experience pain reduction. Because you didn't have pain in the first place.
Okay.
And pain reduction is one of the main reasons we do the knee replacement.
100%. That would I say my number one goal is to reduce your pain, not to eliminate it, not to necessarily get it to zero, but to drastically reduce it.
So if you don't have pain, that's hard to do.
Okay. For me, the next one is going to be significant dysfunction, and so that could be an inability to do things that you either like to do, things that you want to do, things that you have to do, like your job. And then the last one would be sleep. So if your regular life is significantly disrupted to a point that you can't tolerate it, that might be the time to consider a knee replacement.
That's my threshold. People always say, well, would you do it? I always say, if I can't sleep and I can't work, then I would replace my knee.
Right.
Short of that, I don't think I would.
Okay. Other things on your list of how you make that decision?
Yeah, then I look at, or you should look at, your whole life, okay? Your health in general. Are you healthy enough to tolerate the procedure, Okay, if you have a lot of comorbidities, that could be a high body mass index,
Sure.
or bad heart disease, bad
Right.
lung disease, bad kidneys. There's a whole bunch
Poorly
of
controlled
medical
diabetes.
conditions that
Yeah.
can make you not a good candidate. So then we look at the risk-benefit ratio. So the risk of something bad happening goes up with all those things that you might have.
Yeah.
The benefit is how much pain reduction you're going to get. And we want that risk-benefit ratio to really, really, really favor benefit.
Yeah, and I think that the takeaway point is that we can physically do a knee replacement in someone that has a bad heart, like the incision and the bone cuts and putting the metal in place. We can successfully do that, but if it increases your risk of having a heart attack or a stroke to an unacceptable level, that's how that decision is made.
It's the classic joke where the doctor says, yeah, the operation was a success, but the patient didn't survive.
Yeah.
Right? You're not helping anyone in that case.
No, and that's why I think too, as a patient, you're like, listen, I just want this operation. And I think sometimes patients get frustrated with surgeons who won't just like agree to do their knee replacement. It's not because they don't want to help you. It's because they don't want to hurt you. That kind of the vow that we all took, first do no harm.
Or they don't think it'll help you.
That's right. And sometimes I'd say that's the other problem, is that people in their mind feel like the knee replacement is going to be that panacea or that end all be all for controlling their pain. And if they don't have the appropriate pathology, it's not going to make a difference.
Panacea.
Like that, eh?
That's a fancy word.
Yeah. The last one for me is that I feel like before you decide to go to a knee replacement, you need to have exhausted all of the other potential options for treatment.
Why? Why do I have to bother doing all this stuff if I need my knee replaced?
Well, because if I told you that you could take 2 Tylenols twice a day to reduce your pain to allow you to do all the stuff you need to do, that has very, very minimal or acceptable risk to it.
Right.
Right? So if I could do something really easy, like everyone you would think would choose that option.
Yeah. Take the easy road in this case. If there's an easier treatment than a knee replacement that makes you feel okay,
yes,
use that and use it till it doesn't work anymore.
Take the road more traveled, not less traveled.
Yeah, the easy road.
And so what would that include? So for me, that includes medications, topicals, things that you can rub on your knee to reduce the pain, injections, things that you could physically inject inside of the knee to reduce the pain, physiotherapy to strengthen and stabilize the muscles around the knee, a brace that also can work to stabilize, modifying your activity, and pursuing a weight loss strategy.
Yeah, modifying activity is a big one. If you say I stand 14 hours a day, and then the remaining hours I go up and down stairs, and my knee hurts, replace my knee so I can do this.
Yeah.
No, because that kind of activity can't be done even with a knee replacement. So you might have to modify your activities.
Yeah.
And then in addition to that stuff, I would say mental health. Is your mental health such that you can handle this big operation and all the rehab that's required after? Yeah. Okay, that is really difficult on your mental health. Are you in a place where you can manage that? And tied in with that is, do you have appropriate expectations?
Okay.
If you expect to have your knee replaced and then go to the gym and squat 450 pounds.
You literally had a patient that was like that, right?
Yeah, I did, actually.
I know.
And if you think that's what you're going to be able to do with your knee replacement, then you're not going to be happy with your outcome.
Agreed.
Right? Or you might do that 3 times before the knee fails and you need a revision. Right? So you have to have appropriate expectations.
And there's good studies to show that your level of satisfaction directly relates to met expectations. So you want to make sure that the surgeon and the patient have the same expectations.
Yeah, like you meet a friend of mine. He's called expectation.
Yeah. The other thing that I would say about the mental health stuff is that you really need to have a plan and have a setup that increases your chances of success. So if you're someone who is not very fit or not very active and you have a 4-story walk up and you live by yourself and there's no handrails and things like that that are going to make it difficult for you to be successful after surgery, sometimes that's a reason to either not do it or to wait to do it. You want to really have everything in place so that you increase your chances of having a positive outcome.
Yeah, you need
having
some
a
help.
plan.
Yeah.
And some help, yes.
You need some help. The poor guy in the animated show called Up,
yep,
he's going to have to get some help.
Yeah,
he's all alone.
And sadly, there are lots of reasons for this. As our society ages, often I have patients who have spouses that they're the primary caregiver for, and they're like, my knee's really bad, and I'd love to get it replaced, but I have to take care of my husband or my wife or my partner, and it's just not a very good time for me. And I'm always like, listen, wait till you're ready both physically and mentally to do it. You want to be able to go at it kind of full bore and really focus on it ultra.
Yeah. And the whole time you're trying to make the decision, you have to keep in mind that 80% of the time, the total knee replacement works every time. What I'm trying to say is 20% of the time, there's 20% of the people who are not satisfied with their total knee replacement. 1 in 5 people do not love their knee replacement. I didn't make that up. He didn't make that up.
Nope.
That's in literature, scientific literature that we've seen in different countries even.
Right.
American literature, European literature, Canadian literature. All the literature seems to say that around 20% of the people, give or take 5% here and there, don't love their knee replacement.
Right, and this is not to say that they're not better than they were before the operation. I would say, in my practice, like approaching 100% of people are better than they were. But if you're not as good as you were expecting to be, then those are the people that are unsatisfied and would say, I don't love my knee, because it clicks, or it's a little bit stiff, or a little bit sore, which are all not uncommon after having a knee replacement, but better than they were before, but not totally happy. So you really want to temper things.
And having said that, I do occasionally have a patient who says, no, I feel worse than I did before the knee replacement.
Really?
That has happened before. I have seen that, and I've seen that as a second opinion often as well. I do see that often. And then we're going back, and I'm trying to figure out all these things that we just talked about. Were all those criteria met before you replaced your knee? Because usually, if I see someone as a second opinion who isn't happy with their knee replacement, some of those criteria were not met before. That means you weren't having enough pain before,
you weren't bad
or
enough.
your x-rays weren't bad enough before, or you weren't in the right headspace to have a knee replacement before.
Yep.
So those are some of the things. That's the reason we're making this video, is because not everyone loves their total knee replacement. So we don't want you to have it done without having thought about it thoroughly. And if you watch this video 10 times, just keep watching it when you're trying to think about doing your knee replacement, so you really tick all the boxes.
And obviously it changes over time. You'll slowly, progressively get worse, typically with knee arthritis.
That's a good point. You might not feel like it's a good option today, but 5 years from now, now it's a good option.
So now you know, now you have a strategy to assess yourself and your life and your quality of life, but whether or not maybe it's time to start thinking about a knee replacement. Please leave your comments about where you're at in your journey, whether you had it, whether you like it, whether you had it and you don't like it. Please let us know, share, because this actually information is really valuable to all our other viewers, particularly those who are contemplating knee replacement surgery. That's
a great point, because it's easy for us to talk about it, but we really only see it from one side, right? The surgical side, the surgeon side, and we hear all this stuff. If you've had a knee replacement and you're not happy with it, or you wish it was better, or anything like that, leave a comment so someone else who's thinking about having the knee replacement can read through those comments and get some insight from your experience.
There you go. Now you know. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health, and you're in charge of when you want to replace your knee. That can be presented as an option to you, but ultimately the decision to replace your knee is yours.
See you next time.